Why is it that when someone comes to A&E, it's not just a case of, come in, we'll check you now? I don't get it. Well, let me break this down right back to basics. So imagine you've got an A&E department, there's probably 12 doctors in there, 12 A&E doctors, and there's 0 patients. The first 10 people that arrive, yeah, they'll get seen straight away. But the problem is that people don't arrive 10 patients in the next hour, another 10 patients. People arrive at all times throughout the day. In a typical busy A&E, for example, where I work, they get about 250 people coming in each day. It takes time to see people, and there are lots of people waiting. And that's why there's an initial triage when people come in. And this helps us to quantify the risk and see how urgently this person actually needs intervention and needs a medical opinion. At this point, they'll have their observations done. So things like blood pressure, heart rate, temperature. They will probably also have an ECG. They might have some bloods done. And depending on the reason that they've come in, they may get some initial imaging requested. Now that stuff also takes time. For example, if you need chest x-rays for, let's say, 20 people within an hour, there aren't 20 different x-ray rooms. There's usually 1 or 2. And then it's dependent on the number of radiographers that you have. So you need enough radiographers to be able to do that. Then you need enough people to take the person to the radiology department to have their x-ray done. And the porters will be working all over the hospital. So it's not just a case of, as soon as you request the imaging, that patient gets taken to x-ray and it gets done. That's just not how it works. All of these things take time. And then once they eventually get seen by the doctor, they'll probably need some additional investigations or additional things need to be done, or we trial a treatment and then we see what happens. And then that person might be in A&E for another couple of hours while we're waiting to see what happens once the treatment has been administered, while we're waiting for further investigations. And then eventually, hopefully, someone will be safe enough to go home. But all of that takes so much time. It's not just a case of, yeah, come in, I'll see you, treat you, out. When people come to A&E, they usually need multiple other things and investigations. When I've sent people to A&E from a GP perspective, I'm looking for A&E to do some specific things. For example, do some blood tests, because if the blood tests are normal, then the things that I was worried about might not be the case. For example, today I had a patient who had a massive swelling of his elbow, and it was red, it was hot, he had really restricted range of movement. Now, in my head, what's going through my mind is that this could be a septic joint, which means that there could be an infection within that elbow joint. But I can't diagnose that myself. That person needs urgent bloods. Now, if I request the blood test, I probably won't get the result for another 2 or 3 days. By that time, that patient might be really, really unwell. So I have to send them to A&E, because A&E will be able to do their bloods and they will get the results back within an hour or an hour and a half. And if that person then needs to be seen by orthopedics live in the hospital. So then they'll be able to be seen and have the fluid from that elbow aspirated, and then that could be sent to the lab for analysis. All of that stuff has to happen in a hospital. I can't do that from general practice.